I'm married with 4 children, 68 years old. I had a heart attack in March, so therefore I can't have a hip replacement.
I am Professor Paul Lee, orthopaedic surgeon specialised in regenerative medicine as well as orthopaedic surgery. Today we have treated Dawn, who have had a heart attack 3 months ago with severe hip and knee osteoarthritis. So today we have treating her with Lipogem injection into her hip and her knee. First of all, we inject local anesthetic into Dawn's abdomen, and we infiltrate the fat with our local anesthetic cocktail, which will loosen the fat and also prepare her for fat harvest. We inject both sides of her abdomen. We also infiltrate her hip with local anesthetic in preparation for the MyI procedure for injection. Once we've done that, we start harvesting fat from her abdomen with the Lipogem cannula. With that, we taking out the fat, we process that into the Lipogem processor, which micro-fragmented this fat. We also shake this fat within the Lipogem shaker. It will then release and massage those fat to release the parasite within the fat. There are 3 different ways for the Lipogem system to break down the fat. First of all, when we're harvesting that fat, the cannula have break down the fat, and then when we inject it into the Lipogem canister, the first filter is to further break down the fat. After massaging it with the ball bearings, we wash the fat and turn the Lipogem cannula upside down to access the final filter. And we push these Lipogems into a injectable form for this micro-fragmented fat. Within the micro-fragmented fat, it will produce a structure, a tissue that can cushion the joint. Following harvesting and preparation of the Lipogem, we then go into the hip using the ultrasound to guide our long MyI needle to go into the hip, and we managed to hit the hip directly, and as you can see, Dawn is not in any pain at all. And once we ensure that we are inside the hip joint, which I can show clearly with the MyI photo, we then inject the Lipogem into the hip. We managed to inject 10 ml of Lipogems into the hip, and it's very clear, demonstrate that on the MyI. After that, we inject Dawn with another 10 ml of Lipogem into her right knee, and during the whole procedure it's done with local anesthetic, and she was able to walk out of the clinic, and she was extremely happy and delighted with the outcome.